There's something in effect that's been called the Affordable Care Act. It's known as Obamacare. Within days now, even as we speak, and shortly thereafter, the Supreme Court is going to bring down a ruling as to whether or not the federal subsidies that have been given to people under that CARE Act actually violate the act as it is written. Jonathan Gruber, who wrote the act, said indefinitely there were state exchanges, and that's what it was intended to be. We'll see what happens. But the Wall Street Journal is saying, look, if this thing continues as it's currently going, there's going to be an oligopoly that will be all of the 4 or 5 major health providers are going to be merged together. And so we'll have single payer whether we like it or not, and that will be terrible for the American consumer. Well, John Jessup has more on this story from our CBN News Bureau in Washington. Here's John.
Thanks, Pat. President Obama's health care law faces a critical ruling at the Supreme Court, and no matter what the outcome, Americans can expect to see more of an impact from Obamacare. Here's George Thomas with the details.
The case before the 9 justices focuses on the legality of subsidies. Challengers want the court to determine whether President Obama's health care law authorizes tax subsidies for millions of Americans. If the court agrees with the opponents, some 6 million people could lose their tax credits to buy health insurance.
If the court were to rule that the administration's interpretation was wrong, then there are 34 states where people would no longer be able to get these tax credits for buying coverage on the exchange.
That means the cost of health insurance could rise again, and depending on the state you live in, premiums could jump by hundreds of dollars per month. Some Republicans say they have legislation to help those who could lose health coverage in case the Supreme Court rules against the administration. Others say if the court strikes down the subsidy, then it's time to repeal Obamacare completely. The Congressional Budget Office says that would actually grow the economy by 0.7% per year. But if Obamacare continues, the Wall Street Journal warns of major consequences for the healthcare industry, including the potential creation of one massive health system one day run by the government. In an editorial titled Obamacare's Oligopoly Wave, the paper says America's 5 largest health insurers are thinking about consolidating into one monster conglomerate, creating oligopolies with the predictable results of higher costs, lower quality, and less innovation.
This is just one more example of a law that has all sorts of unintended consequences and adverse effects for all sorts of people.
The court is expected to hand down its decision on Obamacare by month's end. George Thomas, CBN News.
Thanks, George. And Pat, any predictions on how the court will rule?
I don't have a clue. I really don't. I think if they got any sense, they'll strike it down, because if they follow the language of the law, it's clear, and the person who was the architect of it said clearly that's what he intended. So they'd have to go against established precedent to uphold that thing. But that's what happens when socialists get their hands on the government and try to impose these crazy schemes. That law was a monstrosity. It should never have passed. It was strictly a Democrat Party operation. There wasn't one Republican who voted for it. And the Speaker of the House said, we've got to pass it to see what's in it. And that's that famous statement out by Nancy Pelosi. They didn't know what was in the law. And they're still trying to find out. It was a huge monstrosity that took about 1/6 of the entire economy of this nation and tried to jam it into a new model, and it's led to chaos and confusion and enormous costs. So the best thing that would happen if the Supreme Court would rule that indeed those state mandates are legal and that what was being done by federal subsidies is not in the law, and then if Congress would go back, strike down the Obamacare and rewrite the thing would make some sense. It's got to be done.